Hi, this is Labra Sherry. If you are studying for your MLS exam, these 10 diseases in hematology section are very important. You need to study them really hard. So first of all, let's start with the big chunk of it. It's different types of anemia. First, let's start with iron deficiency versus chronic disease. They have very similar red blood cells morphology. And the key findings of differentiate them is a decreased ferritin and increased total iron binding capacity in the iron deficiency anemia. And second, we are getting to the megaloblastic anemia. This is often caused by malnutrition. And the key finding about this one is it could be caused by B12 deficiency or folate deficiency, or actually both. And you need to know how to differentiate these two. In a folate deficiency, only the homocysteine test result will be increased. And that's how you differentiate with the B12, because B12 will also have the MMA being increased. And the other thing you need to know about this disease is you will have the hypersegmented neutrophils. And don't forget, pregnant women are more susceptible to have the megaloblastic anemia, but they are not necessarily having B12 deficiency. It's more common for the folate, and that's why they take the folate pills during their pregnancies. Next, we come into the thalassemia. It could be alpha or beta, and in your test, if it's a alive adult, it's always a minor, because if it's a major, that child is not going to survive. It will be dead before birth or shortly after birth. So if you see this show up in your test, it is always a minor. There are 4 genetic spots on this thalassemia. No mutation is normal people. 1 mutation, it could be totally benign. Everything looks normal. 2 mutations, it would be minor. And also the anemic symptoms will also be minor. 3 mutations, it's something related to the hemoglobin H. And 4 mutation, that is major. A major thalassemia is something fatal. You are not going to be alive as an adult and going to the hospital to do the test. So never a major. And in this disease, the key morphology findings are target cells, basophilic stippling, and nuclear red cells. Thalassemia could have a totally normal RBC count. And the hemoglobin electrophoresis is looking for an increased A2 and F. And the next one is the sickle cell disease, AS or SS. The biochemical testing is done by Sickledex, and it also uses hemoglobin electrophoresis to do the final diagnosis of whether the patient is a heterozygous or homozygous. And now, so many students are super confused with are the malignant myeloid versus lymphoid. Let's start with the acute ones. AML, acute myeloid leukemia. This one is very dangerous. You are looking for greater than 20% of the blast on the smear findings, and they will probably testing your knowledge about our rods. This is a cellular inclusion only exists in blast. And the disease they will trying to trick you in is compare this one with the ALL, the acute lymphoid leukemia. The 2 exams you can differentiate the AML versus ALL is the positivity of myeloperoxidase and Sudan black B. And now coming to the chronic myelogenous leukemia or CML. This one, the biggest test point is to test if you can differentiate with the sepsis or benign infections. Both of these could give you an increased basal cells and eosinophils, but CML is a genetic mutation disease. You're looking for a mutation on Philadelphia chromosome. It's T922. And the last disease you need to know in the malignant part is the CLL, the chronic lymphocytic leukemia. This type of leukemia doesn't have blast floating around. Instead, it has a lot of mature-looking lymphocytes. Many of them will be smudged or basket cells. In this one, they will probably testing how do you solve and get a correct lymph count. The solution is remake it and try to do the smear with albumin-treated blood. And now we left 3 more diseases to go. 2 of them are hemolytic. you need to be able to recognize the pattern of DIC versus TTP. The DIC, if you think about it, the TIC will use up the blood component in the patient body to form clot. Therefore, you will be having an increased schistocyte from ruptured red cells and decreased platelet from forming the clot, along with a decreased fibrinogen and sky-high D-dimer. However, in TTP, the thrombotic thrombocytopenic purpura, this one will have normal PTT. And the last high-yield frequency disease in hematology exam is PV, polycythemia vera. This disease is easy to remember because this is the only disease will make you have super high H&H. And the treatment is to just simply poke the patient and release the blood out. In the biochemical findings, you will get a decreased erythropoietin. And the cause of this disease is also a genetic mutation. I don't think it's a high-yield question on the exam, but if they do ask, the mutated gene is called JAK2. All right, so we've been talking 10 diseases that is super important for your exam. Study hard and good luck with your exam.